Hello everyone, welcome back. I hope you are doing good. So, continuing with the series of pathophysiology from the ministry book, the next section is typical pathological process. So, question number 33: a 57-year-old man complains of heart pain, which occurs after some negative emotions. The doctor diagnosed with ischemic illness of the heart or stenocardia. It is also basically the angina. And what mechanism of ischemia is most probable? So after some negative emotions, stress reaction occurs, and for that a sympathetic outflow or sympathetic system is activated in simple language. And what happens is that it leads to vasoconstriction. Now this vasoconstriction leads to ischemia of heart, and therefore angina or the chest pain. And so it is angiospastic. Angio means vessel and spastic means the vasoconstriction. When we look at the other options, obturation is when there is internal obstruction of the lumen of vessel. It can be due to thrombus or atherosclerotic plaque. It can lead to obturation. And compressive is when is blocked when there is some outside pressure or outside force, for example compression due to tumors. So that was it. And question number 34: a plaster dressing was applied to closed fracture of humeral bone. The next day the hand swelled and became cyanotic and cold. So what kind of pathology of peripheral circulation took place? So for fracture, it is either it is fat embolism, and that fat embolism can cause other diseases, but they have written cyanotic and cold and hand was swelling. So it is due to venous hyperemia. So what is the difference between venous and arterial hyperemia is that in venous hyperemia there will be local hypothermia. So it will be cyanotic. So it is blue because the deoxygenated hemoglobin cannot be carried away from the tissue. It stays in the tissue. So therefore cyanosis occurs. So here cyanosis occurs, and it is obviously local hypothermia or therefore cold. And also this swelling, the swelling is more as compared to arterial hyperemia. In arterial hyperemia, since more blood is coming and more oxygenated blood is coming, so therefore it becomes warm and also it looks red. Warm means there is local hyperthermia and also red. So yeah. And question number 35: after physical activities, all of the sudden a patient with thrombophlebitis of the lower extremities developed dyspnea, sharp pain in chest, cyanosis, and swelling of cervical veins. What kind of pathology of circulation took place? So he has some disturbance with his vessels. Now after sudden activity, so it could mean this. The answer is basically thromboembolism of pulmonary arteries. So he has thrombophlebitis. So obviously there's an increased chance of developing a thrombus. And when there is sudden activity due to the circulation, so this thrombus can then move as an emboli and can lodge in the pulmonary arteries. And that can cause all these symptoms: dyspnea, difficulty breathing, and then pain in the chest. And yeah. So moving on to question number 36. A patient with obliterating endarteritis underwent ganglionary sympathectomy. So ectomy means removal. Ectomy means what? Removal of sympathetic ganglion. So obliterating means what? Obturative and compressive. Obliterating is basically obturative type. And so here it is that there is inflammation in the vessel. The inflammation is so much, the inner wall of vessel is so much that it is obstructing the lumen of the vessel and therefore obliterating. Now to prevent that, they have the patient underwent ganglionary sympathectomy. So sympathetic system main function is vasoconstriction, and when this cannot happen, there will be vasodilation, and this problem will be relieved kind of. So arterial hyperemia will occur. Now this is neuroparalytic type of arterial hyperemia. So arterial hyperemia, it can be physiological or pathological. The reactive and working type are the physiological. I'll explain in a minute. And then the pathologic one can be neurogenic or metabolic. So neurogenic again can be divided into two types, that is neurotonic or neuroparalytic. This classification can be found in your book obviously. So neuroparalytic means this paralysis of that nerve. So when there is removal or permanent or irreversible damage to a nerve, it is neuroparalytic. Neurotonic, when it is reversible, it is temporary. For example, when there is stimulation of cholinergic neurons, it is neurotonic. That is to arterial hyperemia. It is neurotonic. The tone of the nerve is kind of increased. And neuroparalytic means there's absence, so removal. So after the alpha adrenergic neurons are cut or removed, for example in this case the sympathetic ganglion was removed itself, so it is permanent, irreversible, so it is neuroparalytic. Metabolic is when the accumulation of some metabolites leads to vasodilation and therefore arterial hyperemia. It can be due to adenosine or carbon dioxide or ATP or ADP. All these metabolites basically they lead to vasodilation. Now reactive and working are both physiological. Reactive is basically post-ischemic. Post-ischemic basically when in a like body cavity like peritoneal or pericardial cavity, there is too much fluid, and after the removal of the fluid develops arterial hyperemia. Now, in this Krok question from 2018, you can see that the patient had ascites, and that means he had fluid in his peritoneal cavity for which he underwent drainage. Now, this sudden removal of that stagnant liquid in this peritoneal cavity led to reactive arterial hyperemia, means that from the pressure difference, because सारा fluid निकाल लिया जब उन्होंने, तो pressure difference के कारण वहाँ पे arterial hyperemia होगा. Now that arterial hyperemia led to decreased blood supply to the brain, which led to his syncope. So this was an example of reactive arterial hyperemia. Now, working hyperemia, basically, for example, when your muscles are working, they need extra blood. So therefore, there's vasodilation of the artery supplying that muscle. Or, for example, during digestion, there's arterial hyperemia in the vessels of pancreas, because why? Pancreatic enzymes are required for digestion. So there's a working hyperemia in that case. So we are done with that. Question number 37. During an experiment, a small crystal of mercury chloride was placed near the mesenteric vein of frog. This operation led to formation of blood clot in its wall. And what is its initial point of thrombogenesis? So mercury chloride, it is very toxic. Like even in pathomorphology also another question is related to mercury, and because mercury is very toxic, it leads to damage of the vascular wall. So yeah, it leads to damage of the vascular wall. So I'll tell you virtual stride. Virtual stride basically tells you when a blood clot forms. It is there can be three reasons when there is stasis of blood flow. So वो जब blood flow रुक जाता है, एक जगह इकट्ठा हो जाता है. So this stasis, and that leads to increased risk of formation of a thrombus. Now, next one is endothelial injury. When there is endothelial injury, the coagulation cascade is activated and leads to formation of thrombus. So hypercoagulability, for example, some factors or some situation that leads to increased activation of coagulation cascade, it will also lead to formation of thrombus. So that is virtuous triad for thrombus formation. Next, a patient with fracture of femur suffers from embolism of pulmonary circle of blood circulation. What kind of embolism it is? So fracture always leads to fatty embolism. Long bones in humans, now they become, the bone marrow becomes yellow and not red, and that yellow basically means because they have a lot of adipocytes, and when this bone fractures, the sum of fat, it comes out and kind of becomes fat embolism. Thromboembolism, when there's formation of thrombus, for example, deep vein thrombosis. Cystic means tissue embolism. Gas, for example, in previous section I told you about Cason's disease, nitrogen gas bubbles, that will be your gas embolism. And air, when some air from outside is injected into the bloodstream, that is your air embolism. Okay, so moving on to question number 39. A 42-year-old woman with neuralgia of trigeminal nerve complains of recurrent reddening and sensation of heat in the right part of face and neck and dermal hypersensitivity. What kind of arterial hyperemia explains these symptoms? So arterial hyperemia, again, obviously when they're talking about nerves, so it is neurogenic, so whether it is neurotonic or neuroparalytic. So obviously there is not a removal of any nerve or ganglion, there's kind of a stimulation. The trigeminal nerve is stimulated, and since it is a parasympathetic nerve, therefore it leads to vasodilation and therefore arterial hyperemia. So this is neurotonic type of arterial hyperemia. Next section, that is inflammation. Tuberculin was injected and into an animal previously sensibilized. In with tuberculin, 24 hours later, hyperemia, edema, and case of injection, and lymphocytes, phenocytes. So obviously I hope you already know that it is allergic type of inflammation. It is type 4 or delayed type of hypersensitivity, and hypersensitivity basically means allergy. So it is allergic type of inflammation, 24 hours delayed type of hypersensitivity. Next, 41, a patient with an abscess of the skin, microscopic examination of punctate of locus of inflammation, plenty of different cells. What leukocytes are the first to penetrate into the tissue from the vessel? So the process of inflammation is quite a long one. I'll probably insert a picture here. The migration itself is quite a long topic itself, but you should know that neutrophils are the first one that come into the tissue. So the order is basically neutrophils, monocytes, and then lymphocytes. Monocytes, when they enter the tissue, they are called macrophage. So this is the order. Like even in the granulated granulomas, you will see that first of all, there are neutrophils, then around that are monocytes, and then around it are lymphocytes. Now 42, question number 42, a 6-year-old child had hyperergic inflammation of upper respiratory tract. The threat of serious respiratory disorder continued the necessity of applying anti-inflammatory hormone. So hyperergic basically means more than normal reactivity of body, and it is obviously hydrocortisone. So the steroids or all the glucocorticoids, they basically have anti-inflammatory property. I hope you already know. Question number 43, modeling of inflammation on intestine, mesentery of a frog revealed peripheral orientation of leukocytes and then migration through vascular wall. What factors predetermine this process? So when there's happening inflammation, there are some cytokines released that then lead to chemotaxis of leukocytes. But so when we look at the options, obviously oncotic pressure proteins does not help in this process. Migration of leukocytes, neither does hydrostatic pressure. And this is influence of some hemotoxic or basically some cytokines, some chemicals that lead to migration of leukocytes. So question number 44, patient suffers from pleurisy or basically pleuritis. A puncture of pleural cavity showed exudate. What is the initial mechanism of exudation? So pleuritis, inflammation. After inflammation, exudate is coming. So as I told you that if for the process of inflammation, there is first vasodilation and then the permeability of capillaries, it increases, and this leads to formation of exudate and therefore the swelling which can be seen when there is inflammation present. So the difference between exudate and transudate is when there's after inflammation, the fluid that is excreted is called exudate. The transudate is the one which is formed. The transudate is the one which is formed after increased blood pressure, and obviously exudate is rich in proteins, while Transudate has less amount of protein. This is the only difference that you need to know for Krok. Next question, modeling on inflammation of the lower extremity of animal conditioned, the increase of its body temperature, the number of antibodies, leukocytes, and SSE. What substance provoked the development of these general reactions, the organism in case of inflammation? So, the one thing that you should remember, that increase of body temperature, it is mediated by interleukin 1. It is an endogenous pyrogen. Pyrogen means which causes fever. Endogenous means it is produced inside the body itself. And obviously there are other chemotactical factors that lead to migration of leukocytes and therefore antibody formation due to stimulation of B cells. That now stimulation of B cells, it is also mediated by some interleukins. I'll insert a chart of interleukins so you can see. So here the answer is interleukins. When you look at other options, the other options are hormones. Obviously, how can they cause increase body temperature? So obviously leukotriene is also another one, but it is mainly for like bronchoconstriction. And yeah, that is what you have to remember. Question number 46. A lot of leukocytes are accumulated in the locus of inflammation. What is the order of priority of emigration of different type of leukocytes? So I told you, first of all, there are neutrophils. Let's look at the options. Neutrophils are the first one. Then are the monocytes. So then are the lymphocytes. So this is the right option. Next, 47. An experimental model of inflammation was reproduced by turpentine oil, and a lethal dose of tetanine was injected into the abscess cavity, but animal didn't die. What is the probable cause of such experiment? Now, if you look at such question and you see, oh, I don't know what is this question, I haven't read about it. Now, let's look at the options one by one. Activation of synthesis of antibodies. Do you think that, don't you think that the formation of antibodies would take some time, and if there was lethal dose of tetanine injected, it would start affecting the body immediately? So how can that save the animal? So obviously it's not the answer. And formation of barrier around the locus of inflammation. Now this can be the answer. Stimulation of leukopoiesis. Again, it's a very long process. Do you think turpentine will stimulate the leukopoiesis, and then leukocytes will form, and then they will prevent against the lethal dose of tetanine? No. Intensification of vascularization in the locus of inflammation. Again, no, it won't happen. Activation of disintoxical function of phagocytes. Again, no, because tetanine is a chemical, it will start acting immediately. And so the best answer would be that formation of barrier around the locus of inflammation. So this was the locus of inflammation, and turpentine acted like a barrier. So when the lethal dose of tetanine was injected here, it could not cross out, it could not come out of the abscess cavity, and therefore the animal didn't die. Simple. Okay, next. A few hours after a patient had burned himself, a locus of necrosis appeared in the field of hyperemia and edema. What is the main mechanism causing destructive processes in the locus of inflammation? So primary alteration basically means due to the agent itself, and it is not quite major. Now secondary alteration is due to the mediators of inflammation. So when there is an agent, the body reacts to it, it releases some factors, and those factors that will cause the damage, the tissue damage. Now this is an example of secondary alteration. The enzymes in secondary alteration can be lysozymes, collagenase, or maybe proteinase, etc. Okay, question number 49. A clinical examination of a patient allowed to establish initial diagnosis, cancer of liver. The presence of what type of protein? Okay, so this is something that you just have to remember, that is alpha-fetoprotein. It is diagnostic of liver cancer. Paraprotein is basically for multiple myeloma or Waldenstrom macroglobulinuria. C-reactive protein, it is an acute phase reactant and it is not specific, it is increased in many reactions. So an experimental animal received sodium nitrogen with food and in 80% a tumor developed, so it is a carcinogen. And it obviously belongs to the group of nitrosamines. Obviously, if we don't know, we can just make it out that nitrosome, so nitrosamine. I'll insert the picture for possible carcinogens. And next 51, a man has been working for the petroleum refining industry for a long time. Which class of carcinogenic agent does he contact with? So petroleum basically is your polycyclic aromatic hydrocarbon. You can refer to the picture before.